Hello again, everyone. I was thinking about this topic yesterday, so I decided to make a short video. And the brief or long title is 9 Reasons Why Prone Lumbar Extension is Not Working When It Should. So prone means simply lying on one's stomach. And when you perform lumbar or low back extension on your stomach, it's kind of like the cobra pose in yoga. You're extending or backward bending your low back from the lying position by pushing up. And it's something we commonly use within the McKenzie method, but it's also used by other people. It's not exclusive to what I do. People use it in both orthopedic rehab and in general exercise. I see a lot of online videos of exercises, notably by trainers, physical therapists, other people who work in the rehab sphere, and for reasons I can get into another time, I don't think it's fruitful to post photos or videos of exercises because as much as I like to simplify the process and talk about using simple movements have nuance, and without a full, broad understanding of why the movement's being performed, there's a lot that's left out. So I just thought of these things that are possible pitfalls to why people who are doing it independently are not seeing the results. And these are things that I'm also coaching patients with or on, and things that I'm observing when I teach people an exercise. So I made a list, so that's why I'm looking down. So 9 reasons why doing a prone press up or prone low back extension is not working when it should be. Number 1, your hands are in the wrong place. That's a simple piece of the puzzle. Where your hands go adjusts where the fulcrum is in the joints of the spine as you press up. Number 2, you're not getting to the end of the range. Number 3, you actually do need some external force to help those joints get to the end of their range. You're not able to do it independently. Number 4, you're lying on the wrong type of surface. Simply put, if you're on a bed, which changes the positioning of your joints in your spine, that's different than doing it on a hard surface such as a floor. Next, you aren't doing enough repetitions at one time. Number 5, you're not doing it frequently enough throughout the day. Number 6, you could be doing the exercise perfectly, but without the context of understanding why you're doing this movement, you're doing things in your daily life that negate the advantages of doing that exercise. Number 7, you decrease the odds of it working by immediately after doing your lumbar extensions, like to stretch into a child's pose because it feels like that's what you need, that lumbar flexion, that low back bending, and you feel like you need to balance things out because the body should be balanced. Well, if we're doing an exercise, we're usually correcting something that's not working well. So by addressing it, we therefore achieve balance. So there's a bigger conversation about that balance topic. Number 8, when you do the lumbar prone lumbar extension, you're going up on your thighs or your knees. So you're not performing the exercise correctly by attempting to let the pelvis stay on the floor. Number 9, you're engaging musculature that we don't want you to. So muscles try to move joints, but muscles can also stabilize joints. So if you're clenching everything as you do it, then you're not achieving the fluid motion that we want. The purpose, and it's individualized, of course, but the purpose generally of a lumbar extension on your stomach is to get to end range lumbar extension. That means arching the back as much as we can. Sometimes we can't go there, but it's usually the end goal. So some people in exercise modalities don't want people to extend the lumbar spine, which I don't really understand that because I think moving joints in general to the fullest extent is a good thing, is a great thing for a healthy joint. But in this case, we want to get to the joints to end range, so we don't want things to be contracted around the low back, pelvis, hips. So I tell people often, just think of it as a chest and tricep exercise. Think of it as an arm exercise. So I might be able to come up with a few more, but I wanted to elucidate the point that we do try to make these things sound like they're simple movements, and by and large, just saying move your back into extension sounds simple, but there's nuance in the way the technique is performed, and it's my job, understanding the complexity of the issue at hand and the person's individual experience, how to coach and how to get that proper movement and see the results. Because if any of those, or a combination of those factors that I mentioned, are occurring, well, then you can have an exercise that, when performed properly, will be extremely beneficial, and instead you'll have an exercise that the patient does and sees no results and abandons. So feel free to leave a comment if you have any questions or disagreements, and thanks for listening.